Hi there, future healers. Have you ever seen a doctor check someone's heartbeat with a stethoscope, look at x-rays, or gently explain how to take medicine? Well, that amazing real-life work where science meets people is called clinical medicine. It's the heart of being a doctor, nurse, or medical worker. And today I'm going to tell you what it is, why it's so important, and what you'll learn if you study it. What is clinical medicine? Clinical medicine is the part of medicine where doctors take care of real people. It's not just reading textbooks. It's talking to patients, diagnosing diseases, choosing treatments, and saving lives. If medicine were a big tree, then clinical medicine is the strong trunk that holds everything together. Doctors use what they learned in basic medical sciences, like anatomy or microbiology, and now apply that knowledge to solve real health problems. What do you learn in clinical medicine? Here are the main subjects or areas you'll study. Internal medicine. How do we treat heart disease, diabetes, or lung infections? Surgery. When and how do doctors perform operations to fix broken bones or remove tumors? Pediatrics. How do we take care of babies, kids, and teenagers when they get sick? Obstetrics and gynecology. How do we help women during pregnancy, childbirth, and reproductive health? Psychiatry. How do we help people with mental health issues like depression or anxiety? Dermatology. How do we treat skin diseases like eczema or acne? Emergency medicine. What do we do when someone is in an accident or a life-threatening situation? Family medicine. How do we become the all-rounders who care for entire families? Each of these subjects teaches you how to think like a doctor, make smart decisions, and care for people with kindness. Real-life example. Chest pain mystery. Let's say a patient comes to the hospital with chest pain. A clinical medicine doctor would ask smart questions. When did it start? Do a physical exam. Where does it hurt? Order tests like an ECG or blood test. And based on what they find, give the right treatment, maybe oxygen, medicine, or even heart surgery. That's clinical medicine in action, solving health puzzles every single day. Why is it so important? Because this is where science meets real people. Doctors learn how to talk with kindness and care, make decisions when lives are on the line, treat illnesses, prevent them, and help patients recover. Without clinical medicine, doctors would just be scientists. But with it, they become healers. Why should you care about clinical medicine? If you dream of helping people face-to-face, making tough decisions that change lives, or becoming a doctor, nurse, or medical researcher, then clinical medicine is your path. In this YouTube playlist, we'll explore each subject step by step, from heart disease to childbirth to emergency care. We'll learn how doctors think, how they care, and how you can be one of them someday. So remember, clinical medicine is where everything you've learned comes to life. In hospitals, clinics, ambulances, and operating rooms. It's where doctors become heroes, where science becomes action, and where patients find hope. Stay tuned as we dive into each part of clinical medicine and discover what it really means to save a life. See you in the next episode, Lifesavers!